Guys, this is Coach Bill with Bill Maybe Online Coaching. Hope you guys are having a great Monday so far. Today, guys, we're going to talk about a problem in the United States. It's a very serious problem. Actually, it's now an epidemic, and that is belly fat around the belly of the young and old. Guys, this is not only a issue with the seniors out there, but this is also an issue now with our younger kids. And if you really look around, or if you go down to the beach, or if you go to the mall, and if you really look around of all the young people that have amounts of belly fat around their waist. What about young married couples? I'm seeing more and more young married couples that both have belly fats around their waist, and of course. It seems like that if you go to a senior center, that most seniors have belly fat around the waist. Guys, belly fat is a large indication, a big indication, according to science, of possible strokes and heart attacks. It's an indicator that if you've had belly fat around the waist for a long period of time, most likely, and this is not me, this is research, is showing us that you could possibly have a stroke or have some type of heart disease. Now, guys, not only does the belly fat around the waist cause strokes or heart attacks, but it also causes insulin resistance, obesity, and also may cause fatty liver disease as well. So what I want to do, guys, is I'm going to actually take you to some research and actually show you what your heart looks like when you have a large amount of belly fat around the waist, and also what your liver looks like when you're overweight as well. Now, some of you may think, well, I don't have that much belly fat. Guys, again, research is telling us that amounts of belly fat, it doesn't have to be obesity, it could only be say, I don't know, 20 to 30 pounds being overweight. If you're holding your fat in your belly, then you are subjected to these diseases like heart disease, cardiovascular disease, fatty liver disease, insulin resistance, and of course, one of the number one diseases right now that's growing rapidly is the young and old, which are diabetic. So let's go over to the science right now. So guys, what I did is I put together a little flyer to give people a better idea of what I'm talking about. And so one of the fastest growing diseases in the United States today among the young and old is heart disease. That's a fact. Now, obesity is now an epidemic among the young and old in the U.S. And the number one cause of death today in the U.S. is heart disease. Interestingly, I found this, there's a common denominator here, guys, and obesity is an epidemic of heart disease number one killer. Could both of these diseases have something in common? So that's what I'm finding out is I'm looking at, okay, what's the root cause of both of the of heart disease and obesity? And it boils down to the same thing over and over and over again. It's what goes in your mouth, you guys, and sugar, and lack of exercise. So what I did is I put together this flyer, and here you see a couple. This is a young couple that I'm seeing more and more today of the younger couples having more than they should belly fat. And most of their fat is around their belly. Now, in the past, it's been with the seniors and baby boomers out there. Most of them are on medication when they have that much belly fat for either type 2 diabetes or fatty liver disease or some kind of heart issues. Most of them are high blood pressure. When you got belly fat like that, that's going to elevate your blood pressure and overwork the heart. But here you can see, guys, this is what happens. This is what your heart looks like when you're holding belly fat. This is a healthy heart, and this is a heart that's holding belly fat. You've got a lot of fat around that heart. That's going to cause issues over time. Fatty liver disease, that's another disease that the young and the old, we're seeing more and more people who have belly fat or are overweight for a long period of time. Most likely they're going to have a fatty liver disease, which is going to cause type 2 diabetes or pre-diabetes, and also liver failure and kidney failure. Now, fatty liver disease is probably for us is one of the easiest diseases to reverse. I've helped many clients with type 2 diabetes who have fatty liver, and we had to reverse the fatty liver first before we were able to get their blood sugars down to a healthy level. But guys, there is a solution, and I'm going to go over the science real quick. I only have so much time. I'm going to go over the science here really quick. So belly fat, this is the title. Belly fat is also the root cause of type 2 diabetes and fatty liver disease. The Journal of British Heart Foundation, a big belly increases your stroke and heart attack risk. According to a widespread media coverage and scientific case studies, if you have a large belly, you are at greater risk of heart and or heart issues. Whether you're overweight or not, we look behind the headline. So the belly fat, you may not be overweight, but if you're holding a lot of belly fat, that's an indication, like this research says. On May 2018, the researchers found that people who were a normal weight but stored most of their fat around their waist had more than double the risk of problems such as heart attacks, strokes, bypass surgery, or death, compared with people who were overweight but not obese and weren't carrying excess weight around the middle. That's incredible. The research from the Mayo Clinic based in Minnesota, USA, at the University Hospital looked at people with a BMI, body mass index, and waist to hip measurements. The researchers suggested that those who with normal weight but more fat around their stomach had an 87% increase of heart issues. Can't deny science, guys. This is some great research. Again, the Journal of European Society of Cardiology, increasing abdominal obesity was independently associated with fatal and non-fatal heart attacks and strokes. Here's another one. WebMed, medical research site, 2010. Children's belly fat affects heart risk. And this research was done on kids. And here's another one. National Library of Medicine, the Journal of BMC, Cardiovascular Diseases 2020, fairly new. A cardiovascular disease risk factor in children with conventional heart disease, unmasking elevated waist circumference. So this was research done on children who had excess body fat around their bellies, and they showed that the circumference in children contribute to an elevated risk of cardiovascular disease. Guys, that is a scientific research done on the kids. So you parents out there, it's your responsibility. You guys need to actually take responsible and get those kids off those sugary snacks and those high carb processed foods. You need to get them on a healthy eating habit, drinking more water, and get them outside, get them off the couch. But guys, there is a solution. And here at Bill Mabry Online Coaching, we have it. We have 3 programs that will actually help to reverse the belly fat and to get your body in more of a healthy environment. We also have a program to help reverse type 2 diabetes and fatty liver disease, and that is part of our online coaching as well. And so this bottom picture, guys, this is me. I was obese. I had a hard belly. My belly was hard and fat. And yes, I had dangerously high blood pressure. I was starting to have some medical issues because of my condition and because of my belly fat. And I was around 57 years old at the time. This is me today, and I'll be 71 this year, and I have kept the weight off for years now, just by following the programs that we are offering on our online coaching programs at BillMabryCoaching.com. So guys, what you can do is your next step, go to BillMabryCoaching.com, hit free consultation, and let's get rid of that belly fat before you have some kind of medical issue down the line. Hey guys, I'm back. Again, guys, do yourselves a favor. Find out the simplest and fastest way to get rid of that belly fat, or if you have, which is causing many heart diseases, which is causing high blood pressure, which is going to also cause strokes. All you have to do, guys, is go to BillMabryCoaching.com, click on free consultation, and let's go over what it's going to take to get you to get on the right track and get rid of that belly fat around the belly. I'm sure you guys don't want to have some type of issue or heart disease or a stroke down the line, because that is going to put you into an environment or that you are probably not going to really enjoy. So guys, again, there is a solution. All you have to do is change the type of food you're eating, change the time you're eating, change the type of water you're drinking to hydrogen-rich water, and get outside and do some type of exercise. But the first 90 days are critical. So that's why it's so important to hire a coach that is actually experienced in how, and it has helped hundreds and hundreds and hundreds of people out there, and who is also following the same program that he is offering on his online coaching programs. Again, go to BillMabryCoaching.com, click on free consultation. Hope to see you guys soon.